For the families in the high-risk unit,
Her cardiac condition places the baby at risk.
every faint heartbeat is a minor miracle.
She was afraid to look at him for fear he might not cry.
Every tiny cry is a major triumph.
Oh my God.
Every extra day
She does stop breathing occasionally, and we have her on a medication.
is a significant milestone.
This baby is in what we call impending failure.
Every second counts in the special delivery of fragile lives.
Is that your lucky cat you're holding?
A little security blanket as I go in. Yeah, I've done it before, but I'm always nervous about those things, so.
38-year-old Leah Mang needs all the luck she can get.
An amniocentesis to see if the lungs are mature.
That's right.
Leah has been on bed rest at Palm Springs Desert Regional Medical Center for the past 2 weeks.
Leah won't scream. She's pretty tough.
They wanted to keep a really good eye on me to make sure that something didn't happen, like I didn't rupture my uterus.
She's 34 weeks pregnant with a baby that must be delivered as soon as possible.
So this is all fibroid here and babies over here.
Leah Mangy is a very interesting case. Early in her pregnancy, they noted that she had a large pelvic mass. So what we're going to do first is we're going to look for an amniocentesis site. Really giant fibroid. It's about 25 centimeters by 25 centimeters, about the size of a small soccer ball, I guess. It's so big it won't even fit on the screen.
It's caused a lot of problems and pushed down enough where it's causing contractions continuously. I've had contractions for months now.
Benign fibroids are not uncommon during pregnancy, but Leah's doctors thought hers might be malignant.
The question when you see a mass like this is it part of the ovary or is it part of the uterus or some other structure? Leah's had a very atypical look. It was very liquid-filled. That's why people were confused and I think thought it was more ovarian.
So we'll wipe all this goop off your tummy, and then we're gonna get everything ready.
A specialist told Leah she'd never make it past 20 weeks. He even suggested terminating the pregnancy.
That we've gotten this far, and every day is just another, it's almost like a miracle.
Right now, the fibroid is displacing the baby and pushing him to the side, which could restrict his growth.
The more this baby grows, it just gets more and more painful. The skin is stretching, and it's like having twins or triplets.
Medication is out of the question because it could do irreparable damage to the fetus.
Get a little pinch.
The only option? Deliver the baby as soon as possible.
Bright white spot there.
Basically, Leah can't take anymore. There's no room for her uterus and this mass within her belly. We're all done.
It was easy. I'm just a wimpy sometimes, so.
Once the baby is delivered, the fibroid should shift and shrink. Because of the enormous amount of blood feeding both the baby and the tumor, removing it during the C-section could be fatal.
The blood supply is so great, you try to take them out, a lot of times you'll end up with bleeding that you can't control. She has significant risks. She could lose her uterus, could require a hysterectomy. Her surgery could go either way, whether we have, probably 50-50 that we have to take her uterus out or not.
Each year, 400 high-risk babies are born at Palm Springs Desert Regional Medical Center.
How's the pain? On a scale of 1 to 10? 5. Okay, we're going up slowly.
In a couple of hours, 20-year-old Stephanie Lewis will add to that growing list.
Yeah, I've been here since 6 o'clock last night, and hopefully I'll be going home 6 o'clock tonight.
I'm gonna go up a little on your Pitocin. We're gonna go up another notch to see if we can't get you into a better labor pattern. or you can have your epidural.
Just 8 days shy of her due date, she's been in a state of induced labor for 4 hours.
Dr. Gomez is here.
All right.
And he's going to break your bag of water.
All right.
Let's get this over with.
I'm sorry.
This should be a joyous occasion for Stephanie and her boyfriend, James.
A lot of discomfort.
I'm sorry.
But it's not. Both are terrified of seeing this baby.
So far, so good, Steph. Baby's head has calmed down also after I ruptured your membrane.
And for good reason.
You hung in there, my friend. We're almost there, okay? Great.
2 years ago, Stephanie gave birth to the couple's first child, a son.
Came out and he wasn't breathing. He wasn't screaming or nothing like they usually come out screaming at the top of their lungs. It was nothing like that.
Baby's definitely pushing down. From the knee.
That baby was born with spinal muscular atrophy and spina bifida, a birth defect of the spine. Various forms of spina bifida occur in about 1 out of every 1,000 births.
You have just a little rim of cervix left. So I think we'll just go call Dr. Gomez and let him know.
They're not sure what causes spina bifida.
The spinal bifida, yeah, but the spinal muscular atrophy, it's a genetic complication disorder. Just there's our genes don't mix.
Ironically, Stephanie had undergone prenatal tests to determine the health of her baby. They all came back negative.
I kept asking the doctor why wasn't he moving like he was supposed to be, and they pretty much didn't give me a logical answer. Just the fact that there was not enough room in there for him. That was the answer. I knew in my heart that there was something wrong.
At first, James and Stephanie experienced a glimmer of hope. Then came the crushing despair.
And he passed away at 8 weeks old.
I'm fine.
Just bring your body. How high?
In less than an hour, Stephanie and James will find out if they have beaten the genetic odds,
Almost there.
or if they will have to relive their nightmare.
Hi, Eva.
I'm doing fine.
35-year-old Eva Harding is having a routine non-stress test.
So these are simple tests that we can do to make sure that the baby's getting plenty of oxygen.
But Eva's pregnancy is anything but routine.
Her cardiac condition makes her high risk because she's very stable right now and she's been monitored closely, but if her cardiac condition would deteriorate, it places the baby at risk. So that's why we're monitoring her twice a week.
Eva has pulmonary stenosis. She was born with a narrow pulmonary valve in her heart.
So the pulmonary artery or vein was too small, and so the heart had to work harder to pump to the blood to the lungs. And they actually said that I would never be able to have children.
Eva had surgery to repair the valve. But at 29 weeks, Eva went into preterm labor, which created more problems for her doctors.
I'm completely effaced, a -1. Some of the medications we use, you can't use in patients with heart problems. So we're kind of limited to what we could use.
Eva's due date is still 2.5 weeks away, but suddenly that changes.
You're in early labor.
Oh my God.
Yeah, so you can have a baby probably in the next 24 or 36 hours. Yeah.
I'll go talk to Dr. Gomez.
Okay, thank you.
You bet.
You're gonna have to go home and get stuff.
Yep.
Although Eva's heart has functioned normally for the past 21 years, it's never been put to this kind of test, and the stress could kill her.
State of pregnancy increases the heart workload by about 50%. And patients that have underlying heart problems that are otherwise stable pre-pregnancy can frequently during pregnancy have the heart condition worsen.
Mommy? Hi, guess who? Guess who?
Guess where?
Yeah, guess where I am?
Hi, Sue. This is Sarah in Labor and Delivery. You ready for us? We're on our way.
Yeah. We're gonna do this, honey. We're gonna make the baby.
Yeah, we're gonna make the baby.
Leah Mang is about to undergo a complicated C-section in the main operating room. An MRI seemed to show that Leah's fibroid is benign, but there is still a chance it could be cancerous. If so, Leah could lose her uterus.
There's some chance that it could be malignant, and it would definitely be taken out if it's ovarian.
We're making a vertical incision now. Her abdominal contour is so distorted.
I'm so glad you're here.
So we're going down through the skin, and Leah's pretty thin, so there's not a lot of tissue to go through. What was that? Moving under my hand. Feel the baby there. This is the peritoneum, and then the uterus is right underneath there.
Giving you good stuff, honey?
You don't know what I'd do without you.
Now we're reaching in to get the baby. A little pressure.
Oh, yeah.
Suction. Beautiful boy.
Sounds good.
Oh man, he's great.
At 1:42 p.m., Vincent Ernest Joseph Gilbert Mang makes his noisy debut.
Sounds good, looks good, cries good, color's good.
All right.
But his lung power is deceiving. Within minutes, he is showing signs of respiratory distress.
Oh, we're just gonna take the baby up and get an IV started. It's requiring a little bit of oxygen on and off. Monitor that. You tell him.
Vincent is moved to the NICU before his mother even gets a glimpse of him.
And it looks like this is a big fibroid.
There's no time. Her tumor needs to be diagnosed immediately. "39-year-old Adrienne Schuler has toxemia, commonly known as pregnancy-induced hypertension.
My blood pressure was originally 170 over high 90s, and it's gone up as high as 200 over 110, with headaches and some blurred vision as well.
Each year, 7% of first-time mothers-to-be confront this problem. Because of it, Adrienne is at risk for a number of life-threatening complications.
At risk for the blood pressure causing internal organs to fail, so liver and kidney functions, and possibility of a stroke or something like that from the elevated blood pressure.
To make matters worse, this morning Adrienne began bleeding and passing clots, signs of a possible placental abruption, deadly to both mother and baby.
The abruption, when it occurs, it severs off the side lining from the uterus wall, which then cuts down oxygen and blood supply to the baby. The baby would be in distress. The baby could die if it were to suddenly separate.
Your blood work isn't very abnormal, but with your blood pressure the way it is and your headache, and you just had a major bleeding episode, I think we kind of have to look at what we have. You're just about 34 weeks. You got the steroids for the baby's lungs. Why wait until you really start hemorrhaging and the heart rate's down and, you know, it's kind of a fire drill? It's better to do these things kind of in a controlled setting.
The news catches Adrienne and Richard completely off guard.
So what is this high-risk pregnancy? Oh.
I'm 33 and a half weeks, and we were really hoping to go at least 36 weeks. It was going to be a good scenario for us, and it hasn't worked out. Very scared. I think we're in good hands here.
But cutting short those crucial 2.5 weeks may prove devastating to the Schuler's baby.
Oh, this is what expecting fathers do. They pace. There's just not enough room in the operating room to pace. A lot of waiting, a lot of hurry up and waiting.
Earlier today, Richard and Adrienne Schuler thought they'd be spending the next 6 weeks preparing for the birth of their child.
Disposable camera. They come through in an instant, so yeah, we didn't really have time to prepare.
But it's about to happen in the next 6 minutes.
She's developed a condition called Pre-Eclampsia or toxemia, and now it appears that she has had a partial abruption of her placenta. both the pre-eclampsia puts her and the baby at risk, but now with the abruption, the baby's at serious risk. No pain? Nothing sharp?
Oh, good.
Okay. The placenta provides the oxygen to the baby, and with it rolling away from the uterus early, it jeopardizes the oxygenation of the baby.
The bad news for Adrian is that now she must undergo an emergency C-section.
We've been walking a fine line with this medical condition, and now we're to the point that the risk outweighs the benefit of continuing the pregnancy.
At any moment, the placenta can shear away from the side of the uterus and suffocate the baby.
We're going about 2 finger breadths above her pelvic bone, and we're going to make a little incision down low in the midline. Okay, scalpel.
The NICU team is standing by. Adrian's baby will be too premature to survive without special help.
That's our uterus right there. Okay, guys, we're about to deliver the baby, and we're entering the uterus. Okay, we're ready. A lot of pressure, Mom. There we go.
Happy birthday!
With the head out, Dr. Gillot discovers another problem. A tangled umbilical cord, tightly wrapped around the baby's neck.
Oh, and that's a double cord.
Two cords around the neck. There we go.
Okay, are you ready?
It is a girl. Congratulations, and she sounds wonderful.
Little Madeline Michelle Schuler weighs in at 4 pounds, 9 ounces.
Oh my God. Oh my God.
Okay, there you go. Oh, that's so Madeline.
This is so incredible. Hey, sweetie.
And while mother and child are both out of immediate danger,
We'll see you later, Mom.
Bye, sweetie.
33 weeks is not enough time for a fetus to develop properly. But the OR is no place for this baby. She needs to be transferred, stat.
She's got a little bit of retraction, so you can see her breathing. She's caving in, her ribs are a little bit labored, but then that might be transient, transitional.
Madeline's small size puts her at risk for serious developmental problems.
And that's a sign of respiratory distress. It can be transient, it can worsen in the next hour or two, but we'll see what happens.
I can't do this.
Eva Harding has been in hard labor for 5 hours.
It started about 5:30 this morning, and we were on very little Pitocin. She's pretty much doing this on her own.
But the pain is too intense.
That one's gone, that one's gone.
I can't. I'm just. It's making me nauseous. I heard so. I'm just.
Eva's doctors are still concerned about the risks of a vaginal delivery.
I mean, there's a potential that I could have heart failure, but they've watched me and they've had echocardiograms, and so they think that I'm okay to handle the stress.
Where is the guy that's the epidural? Please.
Hi, my name is Dr. Osifo. I'm the anesthesiologist. I understand you want an epidural?
Yes.
Yeah, okay. Okay, I'm gonna give us a test dose of lidocaine with epi. I always say if I was a woman, I'd take an epidural 9 months before I deliver, so.
I feel much better. I'm still not gonna have any more children. I'm feeling better now.
Within minutes, Eva succumbs to sheer exhaustion. But it's only a momentary respite. She's about to put her heart to the ultimate test.
You nervous?
Not too much.
I am.
Why? So you get nervous, I'm gonna get nervous. So why are you nervous?
Because they gotta do all that cutting. This
Oh, well, that's all right.
day.
It ain't no big deal. We've done it before.
Horace and Annie Mae Miller have done this before, 7 times.
But this one is different, though. It's as far as we ever
This as far as we ever went.
And I'll tell you what.
37 weeks and 2 days.
Good to see you guys. Y'all ready?
Yes.
Can I change my mind?
No.
Okay.
Despite 7 pregnancies, the Millers have only 2 daughters, Annie Mae has suffered repeated complications with devastating consequences.
You're in trouble.
Annie has a history of several preterm births. She's had 3 neonatal deaths due to extreme prematurity. She also carries a diagnosis of chronic hypertension, so she's on medication for her high blood pressure.
You know you the man. Give me some of that.
This baby will be Annie Mae and Horus's first son.
I'll go put on my scrubs and meet you guys in there.
Yes, go.
Now 35, Annie Mae has never carried her pregnancies past 34 weeks. This baby, 37.5 weeks in utero, seems like an absolute miracle.
This boy has come a long way. And he is ready to come into this world and say, hey, Pops, let's go fishing.
Annie Mae's doctors don't want a repeat of previous pregnancies,
You will feel a poke, honey.
particularly a placental abruption, so they've scheduled a C-section. But any type of delivery can be dangerous for Annie Mae.
This was one of the highest risk pregnancies I've ever dealt with. She has chronic high blood pressure, advanced maternal age. She has so many medical conditions. This will be actually the first baby she takes home with her.
God, we thank you for this time together.
At 8:45, the family prays.
We appreciate you, God. We thank you. In Jesus' name, amen. Here we go. I gotta wait. Gotta hang out. I'm ready. I can handle this. I'm gonna be here by myself.
Although this procedure was scheduled, doctors are about to find out how close they came to an emergency C-section.
You got it. Yeah, she's doing it. Take a deep breath and push.
That's it. Very good, Stephanie. Very good.
Stephanie Lewis is moments away from meeting her son.
9. Let your air out. Good.
That's good. If you can give me 3 good pushes like that, we'll have the baby already. And push.
Push. 2, 3.
And moments away from finding out if he too has spina bifida, the disease that claimed the life of her firstborn.
9, 10. Let your air out. And one more. One more.
When we didn't get to hear him scream in the delivery room, it was kind of devastating. We knew right away something was up. Everything wasn't normal like it should have been.
10. One more. Let's have this baby. Come on, Steph. Let's have this baby.
All they want is to hear this newborn cry.
I just wanted to hear him scream. That's all. Whenever he came out, that's all I wanted to hear. That's the only thing that was going through my mind.
And there's your son. Open your eyes, honey. Open your eyes. He's
So
right
perfect.
there.
Perfect boy.
Well, look at him. He's waiting for you to look at him. Oh, huh? He's got that little lead on his head. We'll take that off. She was afraid to look at him for fear he might not cry, but he did. 1302. Okay, there he is. There he is. Okay, Stephanie, great job. And he's okay, front and back, okay?
Beautiful boy.
7 pounds, 3 ounces.
Brian Eugene Cockrell looks perfect, but the medical team needs to be absolutely sure. In the NICU, baby Vincent struggles with his first few minutes of life. While in the OR, doctors desperately try to save Leah's uterus. Because of the tumor, she may need a hysterectomy.
But this looks like a big fibroid and not ovarian, so we're just going to leave it alone and deal with it another day because it's just too vascular, too big to do anything about it today.
2 hours later, Leah is wheeled directly from the OR to the NICU to see her baby for the first time.
Oh my God. Oh my God. Oh my God. Hey there.
What's his name?
Vincent.
Hey, Vincent.
Hey, Vincent. How you doing, sweetie? He's so big. Oh, he's so beautiful. I'm so happy. best thing I've ever seen in my life.
The doctors notice that Vincent's oxygen level is weak, dipping at times to 80, and his organs aren't getting the oxygen they need.
They need to keep his oxygenation between 90 and 95 preferable, but never drop below 90s.
Vincent still has all the problems facing a 34-week preemie. In the next 24 hours, his breathing could get considerably worse.
Oh,
30 minutes after receiving her epidural, Eva Harding is ready to deliver. Her doctor wants Eva to deliver on her own, but her heart condition might make that impossible. Eva pushes with each contraction, but it's not enough, and working harder could put unnecessary strain on her heart.
We're going to help her with the vacuum, just to bring the baby's head down a little bit lower. That will help her, so she doesn't have to
suction
push
cup
too
with a
much.
handle.
The vacuum will literally suction the baby's head through the birth canal. Although a relatively safe procedure, it could cause an intracranial hemorrhage.
Gonna see mommy soon, okay?
Oh my God.
Eva, finally. Look at that.
Oh
There's
my
your baby.
Oh
You did a good job, girl.
His poor little head. Is he okay, baby?
This is just from the vacuum, but by tonight it'll be gone. In fact, even in a couple hours it'll look way better.
Nicholas Harding weighs 6 pounds, 3 ounces.
19 inches. He'll be shorter tomorrow when his head goes back down.
Oh, baby. Are you okay?
Baby Nicholas is healthy. His mom, though, has a tough emotional road ahead.
You get to clean up the first poo-poo.
I've done my share for a while. It's all you, baby. It's all you now.
Less than an hour into her life, Madeline Schuler has already been weighed
4 pounds, 9 ounces.
and measured.
44.5, 17.5 inches.
But she's 6 weeks early, and that makes her susceptible to respiratory and digestive failure.
Definitely blonde.
But to her mother, Adrian, she's nothing short of a miracle.
So all of a sudden, it doesn't seem real when you're pregnant, and then you have the baby, and then you realize you're a parent. It's overwhelming.
Adrian, a former neonatal nurse, is optimistic.
She's doing well. Got all these tubes and wires and everything, and no crying, no nothing.
But in the next 24 hours, Madeline Michelle is going to take a serious turn for the worse.
Sweetie, Mommy's here.
Steal one of these eggs.
Yo!
What's up?
At 9:36 a.m., doctors in the OR make the first incision of Annie Mae's C-section.
We'll know nothing with her surgery at this point, the fact that she has 3 previous C-sections, so we'll be going in a little slower than on other C-sections, watching for scar tissue and those type of things.
She does have a little bit of scarring, nothing terrible, but we're taking that down.
With the uterus in sight, doctors soon discover how close Annie Mae came to losing this baby.
Boy, I think I'm glad you're not doing this again. Your uterus is very thin.
Really?
Yep,
Yeah.
very thin.
It's a good thing we didn't wait any longer here.
Okay, Alex. I'm sorry.
Well, it's real thin.
It's very thin.
It opened up. I mean, that's why we wanted to do the amnio a little earlier.
Okay.
Yeah, do we have a vacuum? It's a little tight fit, so we're going to put a little vacuum cup on the head and just give a little traction. Okay, vacuum up whenever you're ready.
The pressure from the vacuum results in a small bump on the baby's head, but it will disappear within hours.
There we are.
Look at that! Holy
Vacuum up.
Jesus!
There we go. Suck
What?
Yeah, there we go. There we are. It is a boy.
After a long and somewhat precarious journey, Horus Miller III is born. He is the largest baby Annie Mae has ever delivered, 6 pounds, 12 ounces.
Oh my God. Talk about awesome. You got a big head. That's definitely from your side of the family. Oh man, this boy is beautiful. Yeah, here you come, babe. That's me to the 3rd power, y'all.
Boy, huh?
Look at
You
that.
definitely have a big forehead.
Look at that.
Hey, you.
Isn't he beautiful?
Oh, it's okay.
But the baby is not 100%. His lungs are struggling for breath.
Right now, they're kind of concerned about his breathing is not as going as well as they would like it to be.
Horus has to find a way to tell his wife the troubling news.
That boy has a big head.
Hey.
He got more head than the girls, too. He's just a little abnormality in the respiration, and they just want to make sure that he's okay, so they're going to take him down to the NICU.
Stephanie Lewis's new baby has a 2 to 3% chance of suffering from the same disease that killed her firstborn 2 years ago. So it's imperative that the nurses take extra time checking him for any spinal abnormalities.
We do check the spine, turn the baby over.
Any dimpling along the spine could mean spina bifida.
But so far he's looking great.
His initial physical exam shows everything's intact. He has all his fingers and toes. He does not have spina bifida. He cries. He already urinated. That's a wonderful good sign. He appears to be very healthy.
I feel so much relieved. Everything, he looks beautiful. Everything seems to be fine. She's ready for him.
You the morphine. You were gone.
I know. I heard voices, but I don't know what anyone was saying.
A few hours ago, Leah Mang underwent a complicated C-section. Because of the tumor, Leah was in danger of losing her uterus, but she's been given a second chance.
The doctors, they told me everything was great. They said that the muscles that needed to retract, retracted. We can go for number 2, too.
Really?
Yeah. Yeah, it looks like everything's gonna be great, honey.
Okay.
In 6 to 8 weeks, Leah will be put on medication to shrink the fibroid. Worst case is more surgery. So far, she's doing fine. But her baby is taking a turn for the worse.
Yes, I'd like to see my baby. Vincent Mang. Yes, I am.
24 hours old, Vincent's lungs are getting weaker.
Right now, we're watching his O2 sats. He's under the oxy hood. Our baby's got a little bit of retractions going on in his lungs that we're watching. And we watch also to see how hard he's breathing.
Look at his little toes. Oh, yeah. Tough being a baby, huh?
Oh, he's tough.
Yeah. He's just so beautiful. Oh, yeah. It was so worth it. He's so beautiful.
The oxygen hood isn't doing enough for Vincent. If he doesn't improve, his condition could become critical. Annie Mae Miller just went through her 7th pregnancy and delivered her 4th child, a baby boy. And not a moment too soon.
The lower uterine segment was very, very thin, which reinforced our decision not to wait any longer. If the uterus had ruptured, that would be disastrous for both mom and baby.
This pregnancy will be Annie Mae's last. She has opted for a tubal ligation.
Really, when you see the uterus that thin, it was a good decision for her not to do this again.
The C-section wasn't easy for mother or baby. Horus Miller III ended up in the NICU.
First day of life is the most dangerous time of your life. You're 40 times more likely to die on the day of your birth than any other time during the next 40 years combined. So we always are concerned about newborns.
Already, baby Horus is experiencing respiratory difficulties.
Wow. Just gotta suck some air for a little while. Man, coming to the world, first 2 minutes, stressed already.
The C-section is partially to blame for the baby's breathing problems.
Doc, why is there fluid in his lungs?
Before birth, there's no air in the sac around them, so the lungs are filled with fluid. And after birth, when they take their first few breaths, most of that fluid gets absorbed. Sometimes it doesn't, especially with cesarean section without the pressure pushing some of it out.
If the baby doesn't show significant improvement in the next couple of hours, doctors may have to resort to drastic measures.
Yeah, I'm right here, man. I'll be here for the next 100 years. I'll be here. You can hold my hand for everything.
Adrian Schuler is going home today, but baby Meline isn't.
She was breathing on her own, so I thought that was a really positive sign. And then starting yesterday, she started really having, episodes of not breathing and heart rate dropping. So she's definitely reminding me that she's a premature baby and she's not out of the woods yet.
Mommy kiss?
Hey, sweetie pie.
Born 6 weeks early, she needs time in the NICU to get to full-term growth.
She's going to be in here for several weeks, at least. And she'll have to go home on medication and a monitor to record her breathing and make sure she's okay.
Little Meline is also having trouble feeding.
When the baby is not able to digest the food or has residual, it doesn't get digested, they will spit it up and they can aspirate it, which is very serious. And she's getting a lot of air in her stomach, which put her in distress last night.
Only 2 days old, baby Meline is about to face another uphill battle.
This is one of the happy days of my life.
24 hours ago, Stephanie Lewis didn't know if her new baby would even live. She feared he would end up with spina bifida.
You're awake now.
He didn't. And now Brian Eugene Cockrell is ready to go home.
Hi.
If Stephanie decides to have more children, they too could be at risk.
Yeah, I'm excited. I'm ready to row.
For her, pregnancy will always be a high-risk event.
This is Horus Miller III. I call him H3 for short. And my wife calls him Mac, but I'm gonna call him H3.
3 hours ago, baby Horus's breathing stabilized, and he was transferred out of the NICU.
Now he is 7 hours old. He is now 7 hours old, and he had a lot to eat for a 7-hour-old baby. He ate almost a whole bottle. That was awesome. Just watching it, I was like,
Baby Horus is getting stronger by the minute, but his mom isn't.
Have to come in and check, I would say almost every hour, maybe even less time than that, because she still had some bleeding that wouldn't stop. So they were concerned about that, and actually still are, because it didn't stop completely. They had to make it slow down with some medication.
Although baby Horus is ready to go home, Annie Mae must remain under observation.
My heart's bubbling with joy, because God gave my wife another chance, gave me another chance to bring another life into this world. Yeah, that's what I say, man. That's what I say. I got a whole new life ahead of me.
On his third day of life, Vincent Mang is still struggling for air.
They said this is always just the worst time for preemies.
weeks, that first week is just really hard. I understand completely.
When a baby is born 34 weeks or under, they'll have some degree of respiratory distress.
This is sodium bicarbonate. It's to try and get him breathing better.
Baby Vincent didn't respond to the oxygen hood, so respiratory therapists are trying to force air into his lungs, but he is still fighting to breathe.
So we frequently go 2 steps forward and 3 steps back.
This baby is in what we call impending failure. He hasn't failed completely. He's requiring about 45% oxygen, so we're approaching what we would call failure.
Only one thing will keep the baby's lungs from failing: intubation.
You'll be better in a little while. Okay. You hang in there, sweetheart.
This baby is rather alert and somewhat vigorous, so he's probably one of the more difficult types of intubations because he may very well try to struggle away.
Babies' airways are extremely small, making intubation a very delicate procedure.
I'll open the baby's airway into a sniffing position, and then I'll take my little light and take a look down into his mouth.
With the help of a scope, a tracheal tube is fed through his airway and into his lungs. Without the intubation, baby Vincent's respiratory distress could cause his heart to stop. But even the ventilator can cause serious problems.
He'd be at risk for infection as it's an invasive indwelling catheter. He's at risk for what we call pneumothorax or collapsed lungs, which is a direct risk as a result of the mechanical ventilator. And of course, there's a whole host of potential risk factors involved.
Almost immediately, he shows signs of improvement.
Your chest looks a little better. Yeah, it does.
Tomorrow, Vincent will be 4 days old, and Leah hopes to finally hold him for the first time.
Would I do it all over again? I can't answer that right now. I'm too emotionally distraught.
Only 24 hours old, baby Nicholas Harding is doing just fine, but his mother is having a difficult time.
And I don't know how it works.
His feet aren't even in the thing anymore.
I don't know. Let's just wrap him up. Like, he's supposed to be all cute because too much stuff and unorganized, and I'm all fat and I can't dress him, and it's just ridiculous because they were so inept.
Instead of finally delighting in the joys of motherhood, Eva is experiencing a serious case of the baby blues, known as postpartum depression.
There's just too much stuff. I can't handle all this stuff.
Some ladies will develop some postpartum blues right after delivery. Just all these new changes. You have a baby to take care of. You have your husband to take care of. You have the home to take care of. Everything's just brand new, and most of the time they will adjust to this. Knowing Eva, she's one tough lady. She'll survive.
Mild cases of postpartum depression occur in about 80% of new mothers.
Everything's hitting at once. The responsibility and the motherhood and having to do this on my own. But he doesn't seem worried. So he has confidence in me, I hope. And so I think, we'll be okay. Are you okay, buddy? Just take some time and learn.
She's very curious.
In the NICU, tiny Madeline Michelle Schuler is being carefully monitored by neonatal nurses.
Today is day 3. She had a head ultrasound today to check her brain for any bleeding or anything, and that came out normal. So that's a good sign. Respiratory-wise, she's still on room air. She's breathing on her own. She does stop breathing occasionally, and we have her on a medication to help her to remember to breathe.
But at 34 weeks, Meline still can't feed normally.
These are called loops right here. They kind of go up and down. Sometimes they're really pronounced. They shouldn't be there. You don't have loops, we don't have loops, she shouldn't have loops. Sometimes it's just air that's trapped, and sometimes it's just her gut saying, I don't want this.
Right now, Meline is being fed breast milk through a tube.
I gave her 5 cc's, so she should have no more than 1 cc left, and she has 3.5.
The small absorption rate and the reddish-yellow color of the fluid are cause for concern.
This is what I put in, and this is what I got out, and there's a big difference.
Doctors order Meline back on IV. She can take nothing by mouth until her intestines start to function properly.
If you keep feeding her and stressing it, it could cause the intestine to burst, in which case the abdomen gets big. Yeah.
No one knows when Meline will finally be able to feed like a normal baby.
Look at that brother there.
It's been a long 9 months for Annie Mae Miller and her family.
It's time to go home. I know I've only been here 2 days, but it's time to go.
Here we go. You guys ready? Everything out of here?
Yeah,
okay.
here we go.
Here we go. Finally get to go home.
Yeah, finally get to go home.
After 4 failed pregnancies, she and her husband are taking home a happy, healthy baby boy.
There was a time that I thought that we would never, ever get this far. But now, I have my 2 daughters, I have my son. What else can I ask for? Oh, and I have a dog. We just living it up.
We're getting ready to enjoy the end of this ride, this roller coaster that we've taken. This little individual right here, it took a lot of work to get to where we are right now. So we're really happy with this. This is a plus, being able to just step away and take someone with us.
I can't wait to see you with your eyes open.
Vincent looks so much better than he did yesterday, which was his 2nd day. He looks extremely relaxed.
Yesterday, Vincent Mang could barely breathe. As a last resort, he was intubated and put on a ventilator.
He's completely peaceful and sleeping. They say that's the best thing for him, is that sleep, because that's when he gains all his weight. It's when he's sleeping.
Leah also needs to take time to heal. The tumor that caused so many problems during her pregnancy is now causing postpartum difficulties.
The tumor could impede Leah from having further children because it's the area that the tumor's sitting right on top of is the area that needs to heal. But right now she's got an amount of weight sitting on top of that area, and anything can happen.
Hi, Vincent.
Today, after 18 days in the hospital, Leah is finally checking out.
I can't believe I'm actually turning this corner to leave, to go home. That's great.
But leaving a maternity ward empty-handed is bittersweet.
It's going to be hard leaving him today, but I know that I have to come back every day. That helps a little, knowing that it's only another 24 hours before I see him again.
Even though baby Vincent can't make it home, he made it this far. One of 5 special deliveries and 5 sets of parents pinning all their hopes and dreams on these fragile lives.